And for the special messages, we actually have a keynote address from Dr. Tedros, who is the Director General of the World Health Organization, and he has a message for all of us, so let's go for it.
Dear colleagues and friends, Mahatma Gandhi said it's health that's real wealth, and not pieces of gold and silver. Indeed, the COVID-19 pandemic has taught us that when health is at risk, everything is at risk. Insurance can be a powerful tool for protecting and promoting health, especially for those whose jobs expose them to the risk of sickness, injury, or death. Every year, almost 2 million people die from exposure to occupational hazards. Most workers with dangerous jobs have precarious or informal employment or are migrant workers. Most lack employment, injury insurance, and occupational health services. Many jobs in the health and social care sector are among the most hazardous. In some countries, health and care workers are excluded from occupational health and safety regulations and may lack insurance entirely. The insurance industry can contribute to healthier, safer, and more resilient workplaces by expanding insurance coverage for occupational diseases and injuries. And importantly, they can create financial incentives for businesses to reduce the risks of hazardous working conditions. Insurance can also be an important tool to protect health from the consequences of climate change, air pollution, and environmental degradation. Thank you all for your focus on harnessing the power of insurance for a healthier, safer, and more sustainable future for all of us. I thank you.
Thank you to Dr. Tedros for that amazing message, which tells us about the contribution of life and health insurers to sustainable development. And now I would like to also present a message from Edward Moncrief, who is the CEO of HSBC Insurance Asia and HSBC Life International, who has been the main sponsor and supporter of this ESG guide. We need to thank HSBC Life because the team pushed this work and they made an amazing job really leading everyone in the working group to take us and create this guide, which was created in 6 months, so it was really a record time. The previous ESG guide was created in 2 years. So they made an amazing work, not only motivating everyone, pushing everyone to really create this outcome of the guide that we are going to show you today, but also thinking about what's coming next. What is the next stage of the work? So Ed is going to present a message for all of you.
Hello, bonjour, guten tag, ni hao. As the PSI board member sponsoring the Life and Health workstream, it's my great pleasure to deliver the opening remarks for this session, and particularly to announce the launch of the first ESG underwriting guide for life and health insurers. I'm sorry I can't be with you in person in Zurich today, but unfortunately the combination of a newborn baby and the ongoing quarantine requirements in Hong Kong have made it logistically challenging. Nonetheless, I trust you're all having a fabulous time, and I sincerely hope to see you all in person soon. The release of this ESG guide represents, I think, a coming of age for the life and health industry and reflects our firmly held belief that our core purpose, underwriting risk, has a critical role to play in facilitating better health and well-being for our customers, our business partners, and the communities in which we serve. I think it's fair to say that for the first 10 years of the PSI, our focus has been inherently geared towards the property and casualty sector, as one would expect, considering the more overt correlation between, say, climate change and environmental degradation and the impact on property, liability, agri and construction claims and risk pricing. Life and health insurers have, on the other hand, approached ESG primarily through their role as institutional investors and long-term asset holders. So enlarging the sustainability scope for life and health insurers has been a key priority for the PSI board, and today represents a milestone event. The implementation of this strategic priority began in the fourth quarter of 2021 with the design and the issuance of a PSI member survey focused on sustainability challenges for the L&H industry. We asked our members what was most important to them and where the PSI could most add value. The survey output led to two clear recommendations. The first was to create an ESG underwriting guide for the life and health industry. This guide provides a framework for life and health insurers to evaluate the potential range of environmental, social, and governance risks and factors on the mortality, morbidity, longevity, and hospitalization risks that they underwrite. The guide includes examples of risk mitigation strategies and best practices for L&H insurers to consider as they develop their own ESG risk management strategies. In short, the guide reinforces the key role that life and health insurers need to play in helping to solve for the major ESG challenges of our time. Challenges which have been placed front and center for our industry following the COVID-19 pandemic, such as the spread of zoonotic diseases, social inequality, biodiversity and nature loss, and mental health and well-being. This work has been completed in record time. Only 6 months ago, we set up a global project team, pulling together experts from 12 PSI member companies, representing a broad range of geographically and sector diverse insurers. I owe a massive thank you to all the project team member companies, including Acmea, AIA, the Cooperatives, Ergo, ICA Lion Life, Munich Re, SCORE, Sul America, TD Insurance, Vida Caixa, Zurich, and HSBC Life, as well as all other members and affiliates who were involved in the composition and the compilation of this guide. In addition, I'd like to take the opportunity to thank the World Health Organization for their full support as evidenced in their keynote address, and to the PSI Secretariat, of course, for driving this collaborative initiative between the UN and the industry. Together, we will continue to strengthen the insurance industry's efforts to build a healthier planet and a healthier global population. Thank you. But the work doesn't stop here, as after the launch of the guide today, we will turn our attention to the second deliverable identified through the PSI L&H member survey. The COVID-19 pandemic has exacerbated healthcare demand and supply mismatches across the globe, and highlighted inherent inequalities in medical provision between rich and poor. Successful rollout of vaccine programs have also reinforced the true power of preventative health protection. So in the second half of this year, the PSI Life and Health Workstream will work on the development and the delivery of a research paper to understand how L&H insurers can facilitate a more inclusive and a more preventative healthcare model, and thus help to close the health protection gap globally. We'll set up a project team in the coming months and call upon interested PSI members to join this exciting piece of work. This is a truly timely and impactful initiative, and more details will be shared by the PSI Secretariat in due course. In the meantime, please do enjoy the ESG Underwriting Guide for Life and Health Insurers, and I look forward to hearing from you as to how you are embedding it within your day-to-day risk and underwriting operations. Thank you, Cese, Dodze, merci, Dankeschön.
Thanks so much to Ed for that very special message. And now let's unwrap the contents of the guide, which is already available on the PSI and UNEPFI website if you want to check. So for the panel, I'm going to invite Moira Gill, AVP of Environment, Government and Industry Relations of TD Insurance and Vice Chair of the PSI Board. I'm also going to invite to the stage Chad Park, who is the Vice President of Sustainability and Citizenship of Cooperators, and Stefan Krops, who is the Global Head of Live Business Insights and Governance of Zurich Insurance Group. We're also going to have on the screen Amita Chaudhuri, who is the Group Head of Sustainability of AIA, and moderating the panel, Butch Bakani. So please come to the stage.
Hello, is Amita? Yeah. Hello, Amita. Can you hear us? Yes.
Yes, I can hear you. Can you hear me?
Yep, loud and clear. Hope everything is fine in Singapore.
Everything is fine. Thank you.
Good. I'll just show.
Hello to everyone.
Okay.
Sorry.
I'll just show the cover again. This is the double helix structure of the DNA, and it has been said that discovering this double helix physical structure of the DNA in the 1950s was probably the most significant biological accomplishment in the 20th century, because it showed that how DNA could be the information molecule for all living systems. So that's why we chose that cover. And just to highlight to you some of the elements that Ed had mentioned, so you can. There's a lot of things covered in the ESG guide. We wanted to give you an idea of what are these ESG issues in life and health in the context of the 4 key underwriting risks that Ed had mentioned. The guide also goes beyond simply an ESG heat map, which is obviously very core to the guide, but it shows you how to embed ESG in a life and health insurance organization. Building on what we did for the non-life ESG guide that we launched 2 years ago, actually on an online event with Swiss Re as well, to advance ESG integration for PNC business. So we built on that, adapted it to life and health, but obviously life and health is a very different kettle of fish from PNC. So this is why we are so proud of this report, because it's a coming of age of life and health insurers. And here we're happy to unpack what that guide is all about. So let's start with Amita and AIA. I think Amita, AIA, in terms of market capitalization, is the largest insurer in the world. Is that correct, or did I misread that?
No, that's exactly right. It's the largest life insurer in the world by market cap. You're right. I just want to say a big congratulations to you, Butch. Hello to all listening in first, and big congratulations for the decade of action for PSI, from the humble beginnings to curating memberships, constituting a third of global insurance premiums, and for now looking at how we can amplify sustainable insurance in the UN's decade of action. So just great to be here. So I have a confession to make. I'm not a native of the life insurance industry. In fact, I've spent 20 years the last 20 years in the fast-moving consumer goods industry, last 13 with Unilever, working on sustainability and diversity, equity and inclusion across India, Singapore, and the UK. And the motivation to join AIA from Unilever was actually because of the enormous role life and health insurers, and in fact, AIA can play in advancing sustainable development for Asia and the world. And I can talk more about it, Butch. Maybe I've already started my opening remarks, but I wonder if you want to do an introduction before that.
No, just continue, Amita. I think you're on a roll. It's good. Yeah.
All right. Well, okay. So as I said, the motivation to join was because this is a life and health insurance sector, and this is AIA. And let me just unpack that for you. So one, when it comes to the life and health insurance sector, by virtue of the long-term savings, health, and life protection that the sector provides to people and their families, it's a sector that adds value to society every day. And AIA is, as you said, by market cap, the largest life insurer. It serves the holders of over 39 million individual policies, 16 million participating group insurance scheme members, with over $2 trillion sum assured. But more importantly, we are deeply rooted in Asia. We're present in 18 markets. And with the legacy of trust that we have built over 100 years of operations, with the scale that AIA has with our 23,000 employees and hundreds and thousands of agents, and our influence as a leading asset owner with total invested assets exceeding $250 billion, a large part of which are invested in Asia, we believe that we have a responsibility and a great opportunity actually to advance the sustainable development of this region in Asia and of the world. And this region is particularly significant. Asia is the region that comprises 60% of the world's humanity. It accounts for over half of world's greenhouse gas emissions. And this is where your sustained SDGs will be realized. This is where your climate change battle will be won or lost. And through AIA's ESG strategy that we launched last year, comprising 5 pillars, health and wellness, that speaks to our role as an insurer, sustainable investment, which is about our role as an investor, and sustainable operations, people and culture, and effective governance, that speaks to the impacts E, S, and G within our operations. AI is contributing to not only our purpose that AI has of delivering, of helping people live healthier, longer, better lives, but also advancing sustainable development goals in the region, from Goal 3, good health and well-being, and Goal 10, reduced inequalities through championing financial inclusion, or through our AIA 1 billion pledge that we just made this year, or Goal 13, climate action through our net zero commitment. And as we sort of progress on our ESG journey, as we take greater responsibility for building a sustainable future for Asia, the role of partnerships is enormous. And that brings me to the ESG guide for life and health underwriting. Partnerships such as the one between PSI and the member organizations, and initiatives such as the underwriting guide, serve as significant steps that's going to help us to further accelerating the integration of ESG into insurance business for a resilient, sustainable future. And it's been a truly collaborative effort. Special thank you to Butch, Diana, for Ed, for Claire, for Teresa, to the team for bringing the underwriting guide to fruition. So thank you very much. And it's just great opportunity to be here and have collaborated over the last several months. Thank you.
Thank you, Amita, and it's really good to have a voice from Asia, and particularly for an insurer with a pan-Asian business. Can you articulate a little bit more, what are the sorts of ESG issues that you are grappling with there in Asia from a life and health insurance perspective, and what the value of a guide like this brings to a pan-Asian insurer like AIA?
Yeah, thanks, Butch. If I think about the ESG factors, and we talk about taking leadership on ESG at AIA is about taking responsibility for our most material environmental, social, and governance factors. So we start when we are assessing what are the most significant factors from a materiality assessment, which, as you know, is the cornerstone of a robust ESG strategy. So last year, one of the things that we did specifically for our sector, for our company, was to actually undertake extensive research to look at our first to identify our potential list of material issues where we would, where we are impacting the economy, the environment, and the society. So we looked at the mega trends, our purpose, goal, objectives, the core of our operations, who we are as an organization, the industry standards. We conducted internal and external stakeholder engagement. And then based on that, we identified certain material issues. We prioritized them based on their significance and impact to the organization and for the society. And then we evaluated and validated them through our ESG committee, through the board. Based on that, we've identified three most material significant E, S, and G factors. So climate change, the first one, Asia is most susceptible to more susceptible than any other region to the impacts of climate in the world. So the first is climate. The second is health and wellness, including financial inclusion, and the third one is sustainable investment. And then we have about 9 other material factors, such as selling practices, employee development and management, diversity and inclusion, data privacy and security. So these are some of the material ESG factors. And if I look at the guide, the value of the guide is a tremendous first step, right? So as Ed was saying, compared to non-life insurance business, there's generally been a sort of a less understanding of the discussion on ESG issues for life and health insurance. And a lot of conversation has been around the institutional investing side. So the guide is helpful to better understand the challenges from the insurance side. And just to give you a couple of examples, right? So if I look at the guide, it talks about the E factor, greenhouse gas emissions, physical risk, acute and chronic, and transition risk when it comes to environmental side. So it reaffirms some of the work that we're doing on climate, whether it's making the commitment net zero 2050, signing up to the science-based targets, or the work that we are doing, for example, now with Task Force on Climate-Related Financial Disclosures, doing climate risk maps for countries to understand the impact of physical risk on mortality and morbidity, both acute and chronic. Similarly, on the health and wellness side, right, the guide provides a number of different factors. So, for instance, if I look at the actions that we're taking, we are looking at engaging communities across Asia to improve their physical, mental, and environmental wellness while championing financial inclusion, providing greater access to quality care, and building on our leading integrated wellness solutions. And I can talk more about it, but the guide, again, provides a number of different factors to think about. Aging population, for instance, where and so it reaffirms some of those factors where, for instance, we know that it's a growing issue. There are about 923 million people who will be over 60 by mid-century. So it's an important issue that we need to take into consideration. We have already started with a program in China for post-retirees through retirement planning, retirement funding, and creating retirement ecosystem. But this guide is a reaffirmation of some of the work that we're doing on our material issues. In addition to that, it also provides some of the factors that we should be thinking about and considering. So, for instance, soil pollution or water pollution. So, great value in the guide. It's a great comprehensive list of factors that have not previously been considered, where we can assess risks. And the other important thing is that, and I'll just conclude there, is that the ESG heat map includes some risk mitigation measures and good practices for consideration by insurance organizations. So that, again, from a benchmarking perspective, it's extremely useful.
Thanks so much, Amita, for providing an Asian view on this pioneering ESG guide for life and health. Let's go to another region of the world. Let's go to Canada. And let's start with Moira at TD Insurance. Moira, how has this guide been received at TD? And what has been the impact and the value for TD?
Sure. So we've talked a lot yesterday about the value of collaboration and being part of this working group, being part of developing the flexible framework from first principles has been really valuable for our organization. So it's not just reading a report after it's finished, but having those valuable discussions with your colleagues around the world, testing your assumptions and figuring out together how to approach it, how to develop a flexible model has been invaluable for embedding a deep understanding within our organization, not just for this specific issue, but how we take any aspect of ESG and develop something from nothing. So that's been critically important. Another aspect of this project, which has been unique and uniquely helpful, is we are increasingly trying to embed environment and social issues into the way we do business on a day-to-day, into our strategic planning, so that sustainability is not something on the side. And if you're going to have it in your organization's strategic plan, if you're going to be part of initiatives, internal initiatives or collaborative external initiatives, they need to be done within the yearly strategic planning. It needs to be part of something that you can show results over a quarter or two. And the nature of this approach, where we were taking a scope that could be addressed over a particular period of time, and we could see results and act on it within a business cycle, has been particularly valuable for showing environment and social issues to be part of your day-to-day operations. It's not something that you look at that you're going to address over 10 years or a 2-year project, which doesn't seem relevant to your business right now, but it's something that you can grasp a hold of and get a result in a particular period. So this has been a bit of a change in approach with projects, which I think has been particularly valuable for showing how to bring it into our day-to-day normal operating. We can address an ESG issue, we can figure out how it applies to us, and we can show management a result and begin to integrate it. So that's been particularly valuable in the way we've approached this project.
Thanks. Thanks, Moira. It seems like you're building this system in your company, so you're not chasing issues and addressing them ad hoc. And so you're trying to address them in a systematic way. If we drill down to specific issues, ESG issues in your part of the world, what would these be? Can you just give us some highlights of what are the most material ones that you've seen for TD? Yeah.
So for TD, we have a very large property and casualty company. So when you're looking at the life and health side, immediately you're going to start from where you have a good understanding of risk already, which are the physical risks, things like heat, wildfire, and flood. And so when we look at the life and health business, and there are a lot of customers that cross both, so if a catastrophe happens, the floods, for example, in BC, we have clients who have both property and casualty with us and also life insurance with us. So it's natural for us to look at the intersection of those risks. And so with flooding, for example, if it's not mitigated properly, you end up with moldy basements and respiratory illnesses that come out of that. Certainly with any catastrophe, you end up with mental health issues that might come up much later on. With wildfires in North and Western Canada that we're having repeatedly, there's respiratory issues that come out in the immediate area and much further around the country. So the intersection of those issues, Butch, is where we really are finding an area of natural focus from a business point of view, but also it's often easiest for a business to take, to start from where you know, from where you understand the risk, and extrapolate out from that into other areas. So that connection is where we're really focused.
Right. Thank you, Moira. Let's stay in Canada and move from Toronto to Guelph. Yeah, and
very far.
Not very far at all.
So let's go to the cooperators. Chad, do you want to build on what Moira said? Obviously from your own perspective at the cooperators and how you are addressing ESG in your life and health book.
Yeah, sure. Our story has a lot of similarities to TD for sure. And maybe it's useful to just put some context in terms of cooperators as an organization. So it's, for those who don't know, it's a Canadian cooperative financial services provider, investment advice and so on, and also insurance and multi-line insurer. And we insure almost 1 million Canadian households and have a presence in almost 400 Canadian communities. So, and the organization has had a commitment to sustainability all the way back to 2007, formally, I guess. And a vision, in the vision statement, it says we will be a catalyst for a sustainable society. And that's something that's really, just that particular phrasing has really had a big impact on business strategy and even the culture of the organization. So we've been working at this journey that others have described of integration and embedment of sustainability since then. And but really, I think in fact, the life and health side of the business, like others have described, we've found less connection or engagement on these issues directly over the years. And so my job as VP of Sustainability is to do that integration and catalyzing. And this project and this guide gave a really great opportunity to do that in a way that we haven't been able to before. So it gave it a really tangible focus for me to engage my life and health insurance colleagues in thinking these issues through. And so I think first and foremost that's been the biggest benefit so far, and that's just sort of a ground or a foundation to work from. But then it opens up the actual insights gained from that have opened up some opportunities. And one of them that my colleagues have pointed out to me as we've been doing this is that they've said it's helped to extend the view of causes and effects in the life and health insurance. And by that, I think they're referring to the fact that we may have been underwriting some of these, we were underwriting some of these factors before, but not really paying a lot of attention to what are the underlying causes of those factors. And when you start to think of it in those terms, then you start to look at what are the actual interventions that we could take to potentially to help prevent some of those factors. So all the examples that Moira gave relating to climate change, I think are also very relevant in that context for us, is it starts to make you think about, well, you know, what are the underlying factors, and are there levers that we can pull with our business, whether directly in the life and health area or where there's connection points to other parts of the business to help foster more attention to prevention of those factors. So that's the conversation that started, and it's because of the guide and the work on the guide, and it's going to continue now.
Yeah, I think the point on prevention is very important because it's not simply cure that we want, it's also prevention. And the WHO actually is a very strong advocate of primary prevention. Prevention is better than cure. So anything that insurance can do or insurers can do to really help reduce health-related risk is something that could be really beneficial out of this. Let's go back to Switzerland and go to Stefan. What does this mean for a global insurer like Zurich? What has been the view at Zurich? What has been the perceived value of a guide like this? Because it has been done, that's correct, that's correct, that in record time. The non-life ESG guide was done in a couple of years, 2 to 3 years. This was done in 6 months. We had a base to work with, but life and health insurers were really determined to make this work in time for the 10-year anniversary. So over to you.
Thank you, Butch, and thanks for the invitation. Maybe just one sentence on Zurich. We are maybe better known also for our P&C business. We are a global multi-line insurance group, but we also have a global life insurance business. We are active in Asia Pacific, the Americas, but also in Europe, obviously, and we have our home in Switzerland. So I think, as also Ed mentioned in the introduction, the PSI was coming, I would say, very much from the P&C side and also from the climate action side and a focus on E. Now, I think within the life and health insurance industry, and certainly within Zurich, we were actually really keen to make a contribution and a bigger and a growing contribution for the entire ESG discussion. And now with this underwriting guide, we are putting, I would say, as an industry, a stronger emphasis on the S, because that's what we can address, social elements. That's where we can work in life and health underwriting. So when the work started, there was a survey done among PSI members on the life and health side, or with life and health businesses, about the most important sustainability development goals from a life and health point of view, and the top 3 development goals were good health and well-being, no poverty, and again, climate action. And so I think on the underwriting side, as I said, we can certainly do a lot on the good health and well-being side and on the no poverty side. When it comes to health and well-being, we should really send a positive message, an optimistic message to the world, and that is, first and foremost, as an industry and as a company, we want to, create a brighter future for this world. So we want to support customers to stay healthy. But of course, there is also a need for us to support the most vulnerable customer groups, and that can be those with poor financial conditions, poor financial literacy, but also, again, on the health side, customers with deprived health conditions, elderly customers, and also younger customers, which might be a surprise, but to help younger customers start working and build up their lives. I think we are having similar issues and development goals across the globe, but in different priority. In Europe specifically, as we all know, we've lived through unprecedented times almost, right, with the COVID crisis, and now we have a war in Europe again, which I think none of us could have imagined a year ago. And while this is even a surprise, I would say, to seasoned insurance professionals, it is a strong mental burden for the young generation. So mental health is an important issue that we need to tackle in Europe in particular. And there is an OECD estimate, which is a bit dated from 2018, that the cost of mental health conditions in the EU, 28 at the time, including the UK, was about 600 billion euros a year, which is 4% of GDP. This is as much as estimates by the end of April about what the buildup of the Ukraine would cost. So by addressing the mental health problem, we can basically free up resources to tackle some other important problems. And Butch, you mentioned the WHO. It is true. I found a statement where they said $1 invested into the treatment of mental health conditions creates benefits of $4 in saved costs. That's treatments. In prevention, the multiple is even higher. $1 invested into prevention creates benefits that are up to tenfold. So there is a huge potential for the industry and indeed societies to actually address a big problem and free up resources that can be leveraged otherwise, but at the same time support customers in need and help them live happier lives. So I leave it there. There's much more.
Yeah, you're absolutely correct, Stefan. I think when we did the survey of the PSI membership, I think the top 5 ESG issues were all social issues. And from mental health to diversity to inclusion. But obviously, you touched on something. Obviously, we cannot talk about the life and health guide without talking about the pandemic. So, Amita, what has been the impact of the pandemic on AIA, your business, your strategy, your thinking, and what is it that a life and health insurer can do going forward? What has COVID presented to AIA as a life and health insurer? Oh, you're on mute? Oh, we can't hear you.
Can you hear me now?
Yep.
Okay, you can hear me? Okay.
Yeah.
So if I think about COVID, Butch, okay, the impact. If you think about the impact of COVID, first of all, if you look at Asia, as we all know, COVID has devastated lives and livelihoods, right? And in Asia in particular, 100 million people actually have been pushed into poverty, and there's been a particular impact on women and youth. Also the ILO statistics talk about unemployment levels that have been impacted as a result of COVID. Specifically for AIA, we took significant action during the time of COVID, and I'll speak to that. But if you see the impact of COVID for our business, we saw an increase in awareness from the people, from our customers in terms of the value of life and health protection in particular. But we also had reduced medical claims. As normal hospital procedures were cancelled or postponed while COVID treatment was paid for by the governments. And so that was one. And the other thing was that medically underwritten policies that required customers to take extra medical tests or and visit a hospital or visit a clinic, that level dropped because people were not able to visit the hospital. So overall, if I look at the impact of COVID on AI, there's been an uptick in terms of the awareness and adoption of interest in adoption of health propositions and health policies. So that has increased. What does that mean for us? I think, as was mentioned previously, it means that we've got to make sure that we are helping to contribute to building the social safety nets that Asia requires because of the consequences on lives and livelihoods. And so that means, looking at financial inclusion, looking at serving the underserved, looking also at, inclusion from the point of view of disease prevention. So just to speak to some of the initiatives that we've actually taken on board. In India, for instance, we've got microinsurance as a big part of our strategy, particularly in some countries such as India and Cambodia. So in India, for instance, we've widened financial inclusivity and expanded coverage. Approximately 70% of India's population resides in rural areas. And between April and October 2021, we have a joint venture there with the Tatas. More than 23% of the total policies sourced by Tata AI Life were made available to rural customers. And that includes different products such as affordable endowment and protection microinsurance products, or affordable term insurance products for low-income groups, also a pre-packaged InstaProtect critical illness, hospitalization, accidental disability, and death cover. So this is an example of a microinsurance product that we have. We've got another other interventions with regards to COVID. At the time that it was at highest intensity levels was pre-COVID cover that was provided by different countries within our business for our customers and policyholders, as well as for the employees. So I think that what COVID has done is really elevated the importance of S, and it's important whether we are looking at social inclusion from the point of view of income or age or health. It's important that we take cognizance of that, and the ESG underwriting guide provides these factors as put down these factors and has provided actions that the companies can take in response to the S factors.
Yeah, there's billions of people in Asia, and you mentioned you're trying to reach out to many of them. Have you tried using more of insurtech, like solutions like telemedicine? Is that something being employed there in Asia?
Yeah, absolutely. One of the big trends in Asia, and as you said very rightly, COVID has made this COVID-19 pandemic transforming the remote healthcare market in a big way, right? So telemedicine is a big part of it. Telemedicine has emerged as a primary digital healthcare support tool during the pandemic. And it's allowing customers access to video consultation services and prescription and delivery of medication when required. And in select markets, telemedicine also coverage we provide to pediatricians, psychologists, and a broad range of other specialists. So if I look at telemedicine services for AIA, we have that present currently in 10 AIA markets, China, Hong Kong, India, Indonesia, Malaysia, Myanmar, Philippines, Singapore, Sri Lanka, and Thailand. And absolutely, I think COVID particularly has emphasized the importance of, looking at technology solutions to provide healthcare support.
Thank you, Amita. How about in Canada, Moira? What has been the impact of COVID and the strategies for companies like yourselves?
So certainly we've seen the move to online services, to telehealth, to automation of claims, anything like that. Well, I want to say innovation, but innovation suggests that it was something we planned to do. It was something that we had to do in the moment, was accelerate that direction. So that has had a positive impact in the social aspect. Our life and health business is already directed towards more of the middle market, which is often underserved. And by being able to provide distribution that is accessible to more Canadians, and being able to deliver those services from distribution to administration to claims with less physical contact, we can reach more people and broader social economic communities. So that's been a benefit, but a benefit born of necessity, so I don't really think we should take credit for that. A more worrying trend, and Amita touched on it, is people have not been going physically to see their doctor. So you find situations where health conditions have progressed during COVID without medical attention, so that's certainly a concern. Another aspect is that medical research, quite appropriately, was focused on COVID. So progressing in cancer research and heart and stroke research and other critical illnesses really had, there was a real chill on funding and capacity to work